Assalamualaikum dan salam Malaysia Madani. Dan untuk temu bual radio waktu ini, kita akan bincangkan sesuatu yang berkaitan dengan inovasi dan perubahan dalam bidang perubatan dan juga kesejahteraan. Dan sesi ini untuk menemani anda akan dilangsungkan dalam bahasa Inggeris. Tetapi sebelum kita bawakan dapatan kita, pengisian kita sebentar lagi bersama dengan tetamu kita, kita nak bawakan anda sedikit berkaitan dengan latar belakang tetamu yang kita bawakan di studio pada waktu ini. And before we continue with the interview with our guests, let's get to know the background a little better. Our guest today is Professor Dato Sri Dr. Mike Chan, a renowned scientist, researcher and educator in the field of stem cells, regenerative medicine and anti-aging. He has been at the forefront of groundbreaking advancement in these areas for over 3 decades. As the founder of the European Wellness Biomedical Group and a senator of the BWA, German Federal Association for Economic Development and Foreign Trade, Professor Chan has made significant contributions to positioning Malaysia and Europe as leading destinations for medical tourism, particularly in the field of anti-aging and regenerative treatments. Professor Chan's pioneering work in organ-specific bio-regenerative precursor stem cell therapies has revolutionized treatment paradigms for chronic and degenerative diseases, offering hope to patients who have exhausted traditional treatment options. Through his extensive research, numerous international patents and educational initiatives, he has been instrumental in advancing the field of regenerative medicine and shaping the future of healthcare and longevity. His inspiring journey as a budak kampung, from humble beginnings in Kuala Lumpur to becoming a global leader in biotechnology, serves as a testament to his dedication, innovation, and commitment to improving the lives of patients worldwide. And let's welcome to Bernama Radio, Professor Chan. Hello, Professor Chan.
Hi, Assalamualaikum. Good to be here. I'm just back from USA.
Wow, you have a very unique personality. I love that. And with the tie, and definitely we are very glad to have you here, and we're going to talk a lot about everything, especially when we're talking about writing the code of life, how European Wellness Center is revolutionizing medicine. And let's talk about first, can you explain how you actually work in stem cell therapies in transforming treatment options for chronic and degenerative diseases? Explain the DDRR. It's diagnose, detox, repair and rejuvenate paradigm.
Yes, you see, I'm 63 years old. I've been spending all my life in research, All this is due to the dedication of my father, who is very well educated. He works in the Ministry of Education, and I was born an autistic child, I had a very difficult time as a child. I don't speak until I go to school at 7. I'm actually a budak kampung from Melawati, In those days, we call it Klengate, and I spent 40 years of my life in Switzerland and Germany. And I married a Kadazan lady, a Sino Kadazan by the name of Professor Dr. Michelle Wong. And that's how we spent all our time in Switzerland and Germany, and started everything there with 1 table, 2 chairs. I never realized things will move out until today, where I started with all these years of research, and I love what I'm doing very much. So the dedication, devotion to all this, and the passion is because my father died of complication of diabetes. After his retirement at 55, he said, I want to enjoy all the wealth of life. I've been working with the Ministry of Education at 17, and he died 1 year later. I was in England, and there was no solution for him at that time, And then my father-in-law, who was 72, who looked much fitter than me, and he was a totally healthy guy. At 72, he looked much better than me in my early 20s. And the situation is, he has hypertension all the time. He was on hypertensive drug, and what happened is that he was taking it, and after 30 over years, he have a end-stage kidney failure. And the way he died, the suffering of 1 year changed my perception in life. I was a smoker and drinker, I'm a yuppie guy who say, thank God it's Friday, let's go to the pub and drink, life like this. But on the day of his funeral, I told him, Father, I will never smoke and drink until today, and that's what I did. And today is already so many years has passed by, and I'm still not drinking and smoking anymore. I went back to Switzerland and Germany with my wife. We are looking for the solution of how to treat kidney patients, because he died of end-stage kidney failure. And what happened is that And we actually contribute to one of the world's first publication of reversal of kidney. The kidney can be reversed. Those days, we asked all the doctors in the hospitals who was treating my father-in-law, they will say, you are born with fixed kidney cells. There's nothing you can do on the regeneration of the kidney. And today, we have been regenerating all the kidney all the time, and even with the heart. And I love what I'm doing very much, but the first paradigm we introduced to the world will be DDRR of the European Wellness Biomedical Group, where we also have 46 hospitals and centers from Lugano to Santorini to Frankfurt to all over the place, from Hong Kong or Jakarta or Bangkok or even in Kota Kinabalu and Kuala Lumpur. So the important thing is do a proper diagnosis, then do a detoxification, and then do a repair, and then you regenerate with the cells or the stem cells or the peptides. It is important go in this, and we introduce this to the world. We have trained 80,000 doctors around the world. Education is my first love as a child, and the same with my wife. And I believe we have been to more than 80 countries of the world and across more than 100 regions of the world. I travel around the world for 20 over days for the last 40 years. 20 over days a month for the last 40 years. I just came back to the US, and today I was down here in Bernama. I never expected, and then tomorrow I'll be traveling again to Melbourne.
Wow.
And from Melbourne I will go to Chengdu. From Chengdu I go to Shanghai. From Shanghai I go to Shenzhen, all for one day, and then I go to Hong Kong, and then I move to Cebu in Philippines, and then I move back to Kuala Lumpur for 2 days. Then I fly to Ecuador.
Wow.
In South America, and then I go to Miami, and because I have a presentation or patients there, and then I move to Spain.
Wow.
And then from Spain I go to Abu Dhabi, then I move on to another place. Can you imagine the amount of time I fly? This time I'm flying for almost 2 months without going home, I'm so lucky that my children has grown up. I have 3 boys, and one of them is an autistic child, and today he was an autistic child. Today he's no longer an autistic child. I told you I myself is an autistic child. So can autistic child be treated? I can tell you they can all be treated. We have basically treated more than 600 autistic children in Malaysia alone, apart from Down syndrome children. So they all can be treated. I've treated thousands of autistic children in the Middle East. They have the most autistic children, apart from Down syndrome children of the world. We have contributed to a few medical textbook on autism, and there are solutions for all this. All the diseases of the world can be treated to a certain extent. They are solution.
They are solution, especially for the autistic children.
Yes.
For whatever spectrum they are.
Whatever spectrum. All autistic children have a different spectrum. So it's important to understand which part of the brain there was a disorder. But all autistic children will have an attention span. That means they will not have the eye contact, and this is where you need the frontal lobe or the frontal cortex. So if you give the frontal lobe to them, they will have the attention, then they will listen to the speech therapies much better than before. So I was telling a lot of speech therapists and occupational therapists, the right way to treat these children will be first, make sure they have the attention span. But of course, with all these children, sometimes they also have emotional problem, they don't understand danger to a certain extent. So it's high time to understand the brain itself as one of the most important organ apart from the heart, and 52 lobes, that means parts, performing different function with 67 different types of brain stem cells. So in other words, you have to know which part of the brain there is an impairment, and then you use that part. And how do I know a 3-year-old or 4-year-old or to 30-year-old autistic children, what are their problems? Our oldest patient is a 34-year-old daughter of the Autistic Society of Taiwan, the president himself. He brought a daughter this year, at 33 at that time, and now he's 44. And she is saying that, I do not know what to do, but you have treated my brother who has a stroke a few months ago. He recovered very well because you give the right type of stem cells on where the problem was with the brain, and you give the right type of brain cells to repair, and I see the improvement. Now I'm sending you my daughter. If you can treat him even by improvement of 1%, I'll be most grateful to you. And she improved tremendously, and this is coming from the US Dr. Jennifer Lee, who refer the patients over. So they are solutions as long as you know which part of the brain there is a damage. And how do we know? By attack score or functional test, the mother or the father can fill up that question. Within 5 minutes, we will know which part of the brain there's a damage, because every parts of the brain perform different function. Yeah.
That's very good. You've been sacrificing for over 20 years, traveling all over.
I would say almost 40 years.
Almost 40 years.
Yes.
And what you have been served to the, not just the country, but the whole world just for the research and helping so many people. That's very great, Professor Dato Sri. And as the chairman of and founder of European Wellness Biomedical Group, EWBG, with 46 wellness centers around the world, what specific advancement in stem cell therapy do you believe will have the most significant impact on patient outcomes?
Now, you see the problem with the stem cells, the moment people hear the word stem cells, everyone thought it's so magical. In fact, we all have stem cells in our body. What are stem cells? They are just the super cells of your cells. Just imagine your cells as the bees, and the stem cells will be the queen bees. Of course, the queen bees are the super bees, okay? So you are born with 37.2 trillions of live cells in your body. You have a lot of cells, but there are some very special cells which can regenerate specific part of the body. These are called stem cells. So there'll be one stem cell over 10,000 live cells when you're born. But we all age the moment we are born. We thought we are growing up. We are aging very fast. By the age of 18, you only have 45% left of the stem cells in your body. By the age of 30, you only have 25%. And by the age of 60, you only have 5%. And you will die if you don't have any parts of any stem cells in any parts of the organ. You have 78 organs. So if you were to look at the 78 organs, the brain itself, I say you have 67 different types of stem cells. So in other words, what about the pancreas? The pancreas itself have 13 different types of stem cells. The liver have 75 different types of stem cells. So there are many stem cells all over your body. Now you have to understand which part of the organ there is a damage. So if you give that particular part, let's say you give the cardiomyocyte to treat heart patient, there'll be regeneration of the heart. But the problem now is that everyone thought, you know, in Malaysia, one type of stem cell will cure everything. They will say stem cell will turn into all kinds of cells, or regenerate into all kinds of cells, and they will treat that kind of organs or problem. It's not true. The only time where the cells will differentiate and turn into all kinds of cells will be when they are in the embryonic stage. That is after fertilization. But after the embryonic stage, they'll move further down. They turn into the multipotent stage. These are the tissue cells. We call it multipotent cells. They may turn into certain type of tissue cells, joint cartilage. You know, this will turn bone. But it may turn or it may not turn to. Sometimes it works well for the joint, sometimes it won't work well for the joint. That's why when you inject on 5 patients on the joint, sometimes they see results, sometimes the other 5 don't see the results. So what I want to say is you should go into specific. There was another type of cells, we call it the precursor cells or the progenitor cells. If you go to PubMed, you will see a lot of publication down there. And there are 400 over different kind of parenchymal stem cells here. So the heart, pancreas, liver, kidney, these are all different types of parenchymal organ cells. You want to repair the brain. Let's say for Alzheimer patient, you need the frontal lobe. Then you have to give the frontal lobe of the stem cell. For Parkinson, you need the substantial nigra. You have to give the substantial nigra. For eye problem, you need the retina, optic nerve, occipital lobe. You must give the stem cell of this type of cells. So to make it very clear to everyone, especially the layman or even to the doctors, today you ask a doctor, how many types of stem cells are there in the pancreas? They may not be able to answer you. Let me tell you, these are more on the research side. Doctors are meant for clinical. You know, they are more concerned about the indication and the contraindication and the application. So in this case, I would like to clear up the situation that if you want to treat diabetes type 1 or type 2, you need the pancreatic, it's a pancreatic problem. You need the islet cells, the islets of the Langerhans. That means you need the alpha, beta, delta, exocrine pancreas. If you give the other types of stem cells, you will not do the work at all. So you have to go into targeted organ specific for targeted organ problem. And you have to go into targeted brain specific for brain problem. It is important to go into, in other words, you have to throw all the dart into the dartboard and hit it bullseye. It must be A for A and B for B or C for C, and not an A for A to Z. It never worked that way. There's nothing in the world that there's anything like a stem cell capsule. I would not believe someone would say there's a stem cell shampoo, a stem cell capsule, because all these are dead materials. When you use the word cells, you must have water, oxygen, and nutrients. The cells can only survive within 72 hours. After 72 hours, the cell will not survive. So this will clear the doubt to anyone saying that, oh, I give you a stem cell capsule, it will work very well and treat all kinds of disease. It will never work that way. Nothing can work for everything. It must be very specific. Yes.
Okay, we're talking just now about revolutionizing regenerative medicine, and we're going to talk about more on medical tourism. And with the recent grand opening on August 22nd, officiated by Sabah Chief Minister Dato Sri Haji Noor, how do you actually see the new premier European Wellness Centre in KK, Kota Kinabalu, are contributing to Malaysia's reputation as a hub for medical tourism?
Now, in fact, you'll be surprised. I've been treating a lot of rulers of the state and presidents, and I go to US every month, Las Vegas every month, because I have a lot of celebrities. I treat celebrities, I treat footballers, including the Arsenal football team. In the past, I treat a lot of other sportsmen and all kinds of people. The important thing is that why are all some of these people, including Yolanda Hadid, who is the mother of Bella Hadid and Gigi Hadid, came all the way from Dallas down to Kota Kinabalu for 30 hours she fly. She told everyone that she suffered from Lyme disease. She wrote a book on all this. When I met her in New York and Dallas, she tell her suffering. She say, I have been traveling all over the world spending millions of all the best treatments for my own Lyme disease. And Bella, her daughter, also have it. How do I find solution? But Mike, I remember I went to Germany one day, and I found some improvement there. And I was also shocked at the same time she was that the hospital belongs to me. I'm the owner of that hospital.
Wow.
It was called Villa Medical at that time. Okay, and European Wellness bought over Villa Medical in 2017, and we had changed the paradigm to the next level. And she came to Kota Kinabalu. I treated her a few months ago. She improved so much because she's very much involved in TV shows and travel around the world. And she was telling me I can't last within 4 or 5 hours, and now I can last even 12 hours of working on the TV every day. So there are solutions for everything. All we have to do is which part of organs is affected. You just only have to look into the blood test of the patient and look into the history of patient to find the disorder. So Lyme disease at this moment is untreatable, but so far we've been doing wonderful results with Lyme disease. We've been treating that for the last 30 over years, including our hospital in Switzerland at one time.
And how do you actually envision the integration of regenerative therapies into mainstream medical practices over the next decade?
Now, in fact, when we talk about medicine itself should be very open. So that I would like to use the word integrative. When we use the word integrative, we will have the complementary or alternative medicine like TCM or Ayurveda or all kinds of treatments, including the German way, they call it biological regenerative medicines, added it all into the modern conventional medicine. Conventional medicine, when all means are exhausted, there are no means like treating kidney patient, kidney heart patient is difficult, treating autoimmune problem is difficult. There's no cure for autoimmune in the conventional world, including psoriasis or eczema for dermatologists. So this is where you can move into the way of integrative medicine, complementary medicine to look into this. So again, I like to specify that when you use stem cells alone to treat autoimmune, it will not work very well. So there's another therapy you have to call it. We call it autoimmunotherapy. You call it autologous active specific immunotherapy. We've been using it to treat cancer patients with autoimmune and also a number of other skin disorder patients and autoimmune problems, including RA and multiple sclerosis or rheumatoid arthritis. There are many solutions. There are always solutions for every diseases, as long as the aging organ or the sick organs still have dying cells. Dying cells means they are dying, but they are not dead yet. They can be regenerated. So as long as they're not dead tissue, you can still regenerate the organs. So there are solutions for diseases. And I'm telling all the physicians of the world, we all have to be very open-minded. Don't just stick into one type of conventional medicine and say, sorry, you have this and there's no other solution. We all have to look for solution. All physicians should be more open-minded. The job of a physician is to enrich and heal lives. That is the first part in medicine. But first, do no harm. Primum non nocere. So we must not do harm with any therapies. As long as the conventional medicine will not have a intervention with contraindication with the current conventional medicine, is fine. It's just like when you take medicine, sometimes you have to take supplements. Don't take them at the same time. They allow some gap. That would be the best way to treat.
Okay. As a BWA, German Federal Association for Economic Development and Foreign Trade Senator, how do you actually plan to leverage your position to promote advancement in health and wellness in Malaysia? Especially we're talking about anti-aging, healthcare, longevity, and how do you actually respond to skeptics who say that significantly extending human lifespan is unrealistic?
Now, in fact, I was so lucky to be admitted by the German authorities as a senator or senate member of the BWA, which is the Federal German Trade Association, Foreign Trade Association. and for Germany with Malaysia, and also Germany with China, and Germany, Indonesia. So it so happened I'm so much involved in the stem cell. So recently I was picked up by the German authorities to go to China, and because the Chinese government were looking for a top stem cell expert from Germany, that was in June, and then I went with the German delegation in July and represent Germany to provide answers for stem cell research in China. And I was introduced as a stem cell expert from Germany. In fact, I'm a Malaysian. You know, I will always say I'm proudly a Malaysian. I like to do more for my country. I spent 30 over years of my life outside Malaysia. COVID locked me down. I come to realize I've done so much, saving thousands of lives all over the world. But what about Malaysia, my own beloved country? Traveling more than 80 over countries of the world, I was someone to say I need to migrate and get out from this country. I would say Malaysia is one of the best countries in the world. There's no better place than Malaysia. We should be right back on our own soil, and I believe that it's not just Michelle Yeoh or Jimmy Choo. There's so many other people who can contribute very well. In our case, my wife and I spent all our life, 44 years, in stem cell research, and we have been doing it wonderfully well, and in the field of regenerative medicine. I believe there's more to come, and being contributed so much to the extent that I appeared twice in the front cover of the Chinese Foreign Trade magazine too, which is belonging to the Chinese government. I have 6 stamps on my face in China. But again, it is high time. I would like to do more and work with the Ministry of Health and Education, you know, to disperse information, not just to the doctors, also to the general public. It's high time I'm telling every patient or every client or every person who is not a doctor that the best doctor for they themselves, is never the doctor. The doctor don't have all the time for them. They are the time for it's high time they should learn something about their own health, because the right way is to cut the health costs of every country. Malaysia has been spending a lot of money on heart patient, kidney patient, all that. If we can cut the health costs of all these patients, all this money should move into education and provide better facility for all our nationals. That is the way, cut the health costs, but education must come in.
Yeah. Thank you for sharing your insights and highlighting the center's groundbreaking work. Your contribution, your dedication helps illuminate the future of healthcare for us all. Thank you very much again, Yang Berbahagia Professor Dato Sri Dr. Mike Chan, founder and chairman of European Wellness Biomedical Group, for being with us for Temu Bual Radio English edition for today. Thank you again.
Thank you so much.
All the best to you.
Thank you. Bye-bye.
Baik, sekian saja untuk kita bawa pada Temu Bual Radio.
Thank you so much. You okay?
Yes, thank you.
Temu Bual Radio.